Hi, my name is Megan. I'm going to be your nurse today. And this is Tammy. She's a nursing student who will be following me around today. I'm going to go ahead and provide privacy and wash my hands. And before we get started, could you please tell me your full name and your birth date? Catherine Weber, 4267. All right, Catherine, it's nice to meet you. I'm going to go double check our doctor's orders and I'll be right back. All right, Tammy, so it looks here that the doctor has ordered 12 units of NPH to be administered today at 8. We have a Lispro insulin using the medium dose protocol sliding scale. And then lastly, we have a carb count Lispro insulin as well. All right, Catherine, so it looks like your doctor has ordered some insulin to be administered this morning. And I know this is all very new to you, so I just kind of want to give you a little bit of information. But essentially, we'll be injecting these insulins on a daily basis, and this will allow the amount of carbs that you're consuming in your diet to be used as energy by your body. And so there are different types of insulin, and one insulin that your doctor has ordered is called NPH, which is an intermediate acting insulin, and you'll be taking that every day at 8 o'clock. And then the other insulin that he has ordered is called Lispro, and that's more of a fast-acting insulin, and you'll be kind of doing two different kind of protocols with that. So the first one is called the sliding scale, and so essentially we'll be measuring your blood sugar using that finger stick in your glucometer. And so what you'll be doing is looking at what your reading is for that day. And so for this morning it was 241, so you find 241 on the scale, and your doctor has ordered you to use the medium dose sliding scale. So you'll be taking the 241, sliding it over here to the medium dose, and then based on the 241 this morning, you will be administering 6 units of insulin, of Lispro insulin. And then lastly, we'll be counting the carbs of all your meals, and then administering the amount of insulin based on the amount of carbs you eat. So for this morning, for instance, you had 2 ounces of apple juice, which is 7.5 grams. You ate half of your English muffin, which is 15 grams. And then lastly, you had about 75% of your banana, it looks like, and that is 22.5 grams of carbs. So if we add all those grams up, you consumed 45 grams of carbs this morning at breakfast. And your doctor has created a scale that for every 15 carbs that you eat, you administer 1 unit of insulin. So since you ate 45, you'll be administering 3 units of Lispro this morning. So if we add those 2 Lispros together, we have 6 units plus 3, which gives us 9 total units of Lispro in addition to the 12 units of NPH. Is there any questions about that? Okay, great. So just some things we want to ask you before we get started. Do you have any allergies to any medications? No? Okay. And are you taking any medications currently on a regular basis? No medications. Okay, great. And so, like I said, this insulin is going to allow your body to kind of use those sugars more efficiently that you're eating, and then using that for the energy that your body needs. And so sometimes when we're administering this insulin, your blood sugars can become too low, which is called hypoglycemia. And some of those symptoms are you might start to get a headache, you might start sweating, you might feel like your heart is racing. So just wanted to give you that information so that if you do start to experience any of those symptoms, so please use your call light and let us know if you do, okay? Okay, great. So we're going to go ahead and get the insulins ready, and we'll be right back. All right, Tammy, so now we're going to be preparing the insulin. And so I'm going to bring in our RN, Judy, to observe my calculations and also just do a double check to make sure it is accurate. And so we have NPH and Lispro. NPH is a cloudy solution and Lispro is clear. We are able to mix these 2 specific insulins into the same syringe, and sometimes with a long-acting we are not able to do that. But with these we are. So NPH, we want to make sure we're checking that with the MAR. So we have Catherine Weber. NPH is going to be administered subcutaneously, and we're going to be administering 12 units. And so again, with the cloudy solutions, we're going to be mixing the solution in between our hands like this, making sure not to shake it up and down. That will be just sufficient like that. And then same thing with the Lispro, checking it with the MAR, Catherine Weber. We have Lispro administering 9 units subcutaneously. Expiration date on both of them is up to date. And with the clear solution, there is no sedimentation or discoloration, and this one looks normal. And so I'm going to be putting on a pair of gloves. And then we're going to be cleaning the tops of the vials. And with insulin injections, we are always using a specific insulin syringe that has measurements of units along the side. And so that's what we'll be using. And so to get started, when we have a clear and cloudy insulin, we always pull up the clear first and then cloudy second. And so before we get started with the clear, we're going to insert air into the NPH vial. So since we're administering 12, we're going to pull 12 units of air into the syringe, inserting that into the NPH vial, making sure the needle does not touch the solution. And then with the Lispro, we'll be administering 9 units, so we're going to pull back 9 units of air, inserting that into the Lispro vial, and then drawing up 9 units of Lispro, and then making sure there's no air or bubbles, and then bringing back the NPH solution, inserting that same needle into the vial, making sure not to inject any Lispro into the NPH vial. We're going to then pull out 12 units of NPH as ordered. So we have a total of 21 units in our insulin syringe. So our syringe should look like that: 12 NPH and 9 Lispro. And then we'll have our RN do that same thing, same calculations based on our blood sugar, and just make sure all of our calculations are correct and that our vial does look adequate to those calculations. All right, Catherine, so we have prepared your insulin, and your CNA was just in here taking your vitals, which is helpful. So before we get started, I'm just going to have you state your full name again and your birth date, and check that. Great, thank you. All right, so insulin is generally administered in a couple spots on the body, and so your options are generally around your belly button, on the back of your arm, or on the front part or outside part of your thigh. Generally, the around your belly button is the best absorbed area. So if that's okay with you, we'll use that area today. Is that okay? Okay, great. And so we'll be putting on a clean pair of gloves, and then we're going to be cleaning the area with an alcohol swab in a circular motion. Perfect. Letting that dry. And then when we administer insulin, we're going to be inserting the needle at a 90-degree angle so that the insulin can be released in the subcutaneous tissue, which is the area in between the layer of the skin and the layer of the muscle, so in between that. And so what we're going to be doing is pinching the skin and then poking, injecting, releasing, letting go, and then we're going to be using the safety feature on these insulin syringes. So we're going to pull that up so that it covers the needle so that we don't have any incidents of poking ourselves, and we'll be disposing that in the biohazard container. We don't want to massage the area, so just want to let that be. And then again, with future injections, we want to be alternating sites so that we're not using the same site over and over. So kind of going in a rotated clockwise motion around your belly button, about 2 inches away from the center of your belly button. Those are kind of the areas that we'll want to use in the future. Are there any questions that you have for me? No? Okay, so like I said, just kind of be cautious of those symptoms we talked about earlier. These insulins are not immediate, so it does take about 15 minutes for the Lispro to take action, and it can take a couple hours for the NPH to take effect. And so, and overall the duration is for multiple hours. So if you start feeling any of those symptoms, please use your call light and let us know. Is there any other questions? Okay, great. So I'm going to wash my hands and then take off my gloves and wash my hands, and then document in the MAR that we administered 12 units of NPH subcutaneously at 8 o'clock. And we also administered 9 units of Lispro subcutaneously. And then we'll sign and date here.